New data out this month from national health leaders shows mortality rates for infants and new mothers have been on the rise for the last few years, including during the start of the COVID-19 pandemic.
As Arman Rahman finds, the discussion is shifting to communities already facing deficits in health and child care.
Eric and Charlotte, the American Academy of Pediatrics found the rate of sudden infant death syndrome in 2020 was highest among non-Hispanic black babies and nearly 3 times more than the death rate for non-Hispanic white babies. The immediate cause is still being studied, but a health expert I spoke with today says the racial disparities in our society are nothing new.
In some ways, this is not unexpected per se.
Maybe not unexpected, but still alarming. The rate of sudden infant death syndrome increased 15% from 2019 to 2020, moving from the 4th to the 3rd leading cause of newborn death and disproportionately affecting black families.
It's not clearly clear that COVID was the factor in the spike in sudden infant deaths among black babies.
The numbers were just as bleak for black mothers. According to a recent CDC report, in 2021, the rate of pregnancy-related deaths of black women was more than double the rate of white women.
And it seems that COVID may have played a role in some of the uptick in pregnancy-related deaths that we saw most recently. But it's not fully clear.
The study says it's possible the pandemic's extra stress on people of color with housing, food insecurity, education, and more could have contributed to maternal and infant mortality.
Yes, I found the speculation in the paper to be a little bit problematic.
But Tiffany Green, associate professor of obstetrics and gynecology at UW-Madison, takes issue with that portrayal.
Public health sometimes it treats black people as dysfunctional rather than systems. And the reality is, there have been racial disparities in prenatal care for a long time. There have been racial disparities in food insecurity for a long time.
She says she'd rather the public shift its thinking from individuals to our deeply rooted systems.
Some groups don't have as much access to care. Well, why? How can we fix that? How can we make sure that everyone has access to postpartum supports and that families are not on their own?
Wisconsin has one of the highest black infant mortality rates in the country and has been identified as the only state in the country where the life expectancy gap is growing between white and black women. Brady and Charlotte.